Welcome to Conversations in Medicine. I'm Dr. Allan Perel. This program brings cutting-edge medical topics to the Staten Island and tri-state community. We have an interesting topic tonight. We're going to talk about small business and health. A lot of the things happen even going to your doctor's office, being afraid of getting sick, going to the hospital, going to a restaurant, going to a beauty salon. And we have experts in the field who are going to help us really talk about how to protect yourself. We're right now in the cold season and flu season, and we really want to try to keep everyone as healthy as we possibly can. So I have a wonderful group of guests here tonight. I'm going to go from all the way down to Dan Ostrowski, a nurse practitioner who works at our practice in neurology. I have Priya Peter, another nurse practitioner who works at our practice. Thank you for coming. I have Michael Mortensen, who's the owner and a stylist of a popular Staten Island hair studio. And I have Lihari, who is the manager of a popular Italian restaurant on Staten Island. So welcome.
Thank you.
And I have Lou here, so I'm going to go right to the thing that most people think about. Restaurants are sometimes scary places. You think about what's in your refrigerator, you think about what you're cooking. Are things overcooked, undercooked? Are they safer than or not? Tell us a little bit about, as someone who runs an Italian restaurant, what kind of things do you worry about with regard to your clients, your people, your patrons, that they leave healthy? Because clearly, if someone comes to you and they get sick, they're not going to come back. And of course, you're worried about their health also. So tell us a little bit what you do.
So it's very important, food storage. Temperature danger zone of food is between 40 and higher. So food like to be stored below 40. So health department inspectors come and they like to know that your temperature of refrigerators are below 40. Also sterilization of cutting boards, utensils, sanitary regulations with the workers, making sure hands are washed is very important. It's also very important that there's hand washing stations where food prep areas are to prevent spread of germs and all that kind of stuff.
So tell me, if someone cuts themselves, I mean, you have a chef, you have
Yes.
cooks, you have people, there's sharp knives in
Of course.
restaurants. What if someone injures themselves or cuts themselves?
So open wounds need to be covered. Something happens during work, we try to mend it at the spot. If it doesn't get mended, we need to send somebody home. It's a situation that happens very often.
So Michael, tell us a little bit about a beauty salon, hair studio. I know you've worked at them one, and we've spoken before for a number of years. Tell us a little bit what you do to ensure the safety of your clientele, the people who come in.
Well, what we like to do, we have each stylist on their station has from a company called Ultronics. They have a holder, it's a disinfectant, it kills Hep C, it kills HIV-1, Hep B. We make sure after each and every client, our combs are cleaned, our brushes are cleaned. Even the manicurist and the esthetician, they use an autoclave, almost like the dentist office, which after each client that they see, they sterilize and they even put their utensils in a bag. So when you're sitting in their chair or laying on their table, they open the bag to show you everything's sterilized and ready to be used.
So do you think a lot of this is word of mouth, interestingly enough? If you think about a restaurant, a hair studio, is a lot of it word of mouth that a place is safe, that no one has gotten sick there and the food quality is good, and at a studio such as yourselves? Or do people just have to figure this out on their own?
No, it's 1,000,000% it's word of mouth,
Yeah.
especially in our business. And as the internet today, they have many sites, people throw reviews, they throw their opinions. So yeah, you have to always be on top of everything. You have to always make sure everything's clean. Even me as the owner, I'm constantly 3-4 times in the bathroom making sure everything's clean, Cloroxed, fresh paper towels, soap, etc.
So tell me about Julia, what do you guys do to prevent, to think about it? It's by reputation,
Yeah,
obviously.
reputation. First thing what you see when you walk inside the restaurant is a letter grade right on the front door. A, B, C, pending, fail. So restaurants can fail. What happens is the health department closes down the doors until you remedy all the situations. An A grade means you have 13 points or less. So you can have a few minor situations that they'll still get and give you an A. B grade is between 12 and 24 points, and It might not be minor things or could be major things, but you can still
That's
operate.
like temperature issues and
Temperature
cleanliness and-
issues, cleanliness, all that kind of stuff. You can even operate with a C, but like you said, reputation is at the risk. Guests come in and see a C, they might not feel comfortable eating at your establishment.
So Priya, now we'll get to you a little bit. I see the people with the white coats, so now I have to talk to you. So tell me, you work at our practice. It's been a pleasure to work with you. I know you also worked in the emergency room for a while at the hospital. Have you seen in the emergency room cases of people who've gone to a restaurant and had something poured, or gotten cut at a beauty salon and things like that? Anything happen in the emergency room setting? Because I think we see a lot of things. And maybe tell us a little bit about it.
Yes, definitely. In the emergency room setting, we see all different kinds of situations that people come in with. But one of the main things is if anyone's having any kind of fever, nausea, or diarrhea, the triage nurse is always first line to assess that. So we figure them out right at the front door, because we have to figure out where to put them. Are we going to isolate them? Are they going to sit in the hallway? Are they going to be in a room, because they can infect other people? So we do see stories of people, coming with wounds. If it's a cut, the number one thing is tetanus vaccines. Vaccines are very important to fight against infections. And then if it's something related to food, it sometimes is like nausea or diarrhea, which usually passes within 24 to 48 hours.
So Dan, at a neurologist's office, I know you work one that's very close to my heart. We try very hard, and Dan, everybody loves to go to Dan if there's anything wrong with them in my office. So, because he's empathetic, he's wonderful, he's listening, and he always has the answers.
Yeah.
So tell us, working in a doctor's office, in a neurologist's office, what kind of things do you think, both with regard to patient safety, that really have to be explored, and what do patients have to know? And again, I use the word patients, patrons, customers, all kinds of different words. What do people have to know when they go to a doctor's office? What are they looking for? Washing hands, things like that. Tell us a little bit about how we protect and how people should be protected.
Yeah, so washing hands is obviously always important, especially between patients, because that's the number one way of spreading germs. Make sure if you're doing a procedure, you're wearing gloves, and if you take your gloves off, you wash your hands after. Cleanliness is a key, and kind of everywhere you go, you want to ensures like safety. You feel comfortable that you're going to a clean place, and especially if you're sick, you don't want to catch anything else.
Tell us about masks. And I mean, I just flew down. I was at a meeting this weekend, and I think half the plane had a mask on. And tell us about masks. Should people wear masks if they go to the doctor's office and they're sick?
So, yeah, I mean, so when it comes to sneezing and coughing, actually germs can spread up to 3 feet. Keeping that in mind, wearing a mask when you're sick is a great idea to prevent further spread of illness. Especially in the workplace, if you're working around, with other sick people or your fellow employees, you don't want everybody to get sick, on top of it. There's, regular mask kind of protects against large particles, where there's a mask called N95 that protects against smaller particles. Painters use them, and people who deal with different spray paints. So different kinds of masks. But nonetheless, if you have a cough or a cold, it would be a good idea to wear a mask just for the safety of your coworkers and the safety of the patients that you're dealing with.
So Lou, back to the restaurant, because I think the restaurant's such an obvious case of protecting everyone.
Of course.
It's protecting the staff, because anybody, and I think about myself, I'm not very good in the kitchen. That's why I go to your restaurant so often. The idea of having knives and sharp knives around, what do you do to protect both let's talk about the staff first. I know we talked about the patrons with regard to temperature, and talked about this. What do you do to protect your staff from getting hurt? And do you have any policies, or how do you handle it in a busy place?
We offer sick days to our employees, whether they have the flu, they injured themselves, and we have a lot of staff on call. So we offer them a sick day, and we do have somebody to cover their shift. Some small businesses don't have that people on call, so it's difficult to find a replacement worker to come and fill in their position. And we also offer training, how to handle knives, how to handle utensils and stuff, so they don't get injured.
So how do you train someone to how to handle a knife? Is there
So it's usually on-the-job training a lot. So obviously, I'm not that good in the kitchen either, so I just try to watch them, pick up some details, and first-hand experience, you just gotta grab it and do it.
Okay.
Yeah.
I mean, I've seen you guys, take a Dover sole and,
Yes.
and fillet it. I know you're good with knives. I can tell that.
Yes.
So, Michael, tell us a little bit about with your staff. I mean, a lot of people are standing on their feet a large portion of the day. I see patients from various hair salons because their back hurts, their legs hurt. Sometimes they have carpal tunnel from cutting or just doing things
Yeah,
repetitively.
it's definitely
What do you have?
something that happens after prolonged years of standing on the floor. They do offer support mats that a lot of our stylists use. They have support socks, even the carpal tunnel things for your hands. But you just really got to take care of yourself, and even like some physical therapy and just exercise just to keep yourself healthy and well enough to stand there for your clients.
What kind of shoes should they wear?
You know what? Like we always say in this industry, when a newcomer comes out of school, they want to get dressed to the max. They want to wear 6-inch heels. It's not the case, because in 20, 25 years, you're going to have a broken back. You're going to need something. So wear something comfortable. You could be stylish, but even rubber soles, or they don't have to be sneakers. But there's a lot that they offer out there, and very stylish too.
No, and that happens with my staff too. And Priya, the first day you came in here, you had high heels on.
I was just thinking that.
And that's good. That's good.
And then the next day, I went back to my nursing shoes.
Yeah, a lot of even the stylists even do. If they come in with a little bit of a heel, maybe through the course of the day, then they do. If their feet are bothering them, then they change their shoes.
Right.
Yeah.
So Dan, let's talk about, again, different kind of things that we look at with regard to the staff and the people who come in. What kind of thoughts? I mean, you were telling me about with regard to boiling things. When we talk to our patients, again, we talk about being sick in the workplace, but we take care of people who are sick. And what do we tell them about this type of we see so many people with Parkinson's disease, people with dementia, people with MS, people with walking problems. Is there anything in general that we talk to our patients about their general well-being?
Well, it's always good to follow up with your doctor at least once a year for regular blood work, get checkup, take your medications that are prescribed to you on time. In particular, if you are sick, especially with antibiotics, just remember that if you're feeling better, to still continue to take the antibiotic. I feel like that's a common thing that people once they feel like they're starting to feel better, they stop taking the antibiotic, and it can create some resistance that we're seeing today, actually. But yeah, just follow up for your annual physical, and just maintain a healthy lifestyle, both physically, mentally, and eat as well.
I think one of the things that Priya mentioned that I think is so crucial were vaccines. I mean, there's been a lot of up and down about vaccines, and we actually had a show devoted to vaccines a few months ago. The idea you can't go into the hospital without a vaccine, and the punishment they have in the hospital is they'll take your parking spot away. So if you don't have a vaccine, your ID won't let you into the parking garage, and for that, the vast majority of us will do anything. So tell us a little bit about vaccines in our patients. And, Dan, tell us a little bit about, and Priya too. Tell me what vaccine should people take? Should we flu vaccine, other kinds of things?
Definitely the flu vaccine. Flu vaccine, children, babies 6 months and older are allowed to get it. Pregnant women are allowed to get it. It's a vaccine that has helped many people because it causes people have been dying more and more often with the flu. So just even working with staff, if everyone has their flu shot, no one has to wear a mask, and you just prevent yourself from getting that, flu viral infection. But another thing also is just like hand washing and keeping yourself, physically and mentally active will just prevent you to be able to work and not be sick.
So what do you guys, do you encourage your staff to get a vaccine? I mean, I know it's not in your edict of a manager or an owner of a hair studio. Tell me a little bit about how do you take care of your people? Because I've always seen this. The people we work together as colleagues at my practice, everybody cares so much about everyone. If someone is sick, and I'm not talking even medically ill, I'm not talking about a cold or things like that. The whole office is just so moved, and we're so worried about them. And I know you're a family.
Yes.
Your group's a family. Is there anything that you do as the manager, as the owner, to try to talk about their general health?
Us in general, I don't, if you go for a flu shot or if you go for these vaccines, then that's on your behalf. But in the salon, we constantly have if you're not feeling well, we have a whole pharmacy in the salon just to make yourself try to feel better. And if you do come in and you're that sick, we have to send you home. We can't have you working on a client, like they said, coughing and sneezing, and it's not good for your behalf as well as theirs.
Tell us about your group. I know there are a lot of friends of yours who work at your
Of
restaurant,
course.
a lot of relatives.
Yes.
How do you everybody try to care for themselves?
So we actually try to encourage the flu shot. You know, we do have a lot of customers coming in and out, don't know who has the flu, where we can contract it from. So we do encourage the flu shot. We do encourage, many of us go to the gym, we stay healthy, we like running, so we do encourage that actually as groups as well. So after work sometimes, a bunch of us we'll go bowling, you know, try to stay active, play basketball, something like that.
So again, the health of the whole group is so important. So now I'm going to go back to you, Priya, a little bit. When people come into a doctor's office or into the hospital, what kind of things should they be looking for? And we talked about some cleanliness. And what kind of things? And again, we have a wonderful audience. We have people who watch us every week, every month, and try to say to themselves, you know, the healthcare issues when they go into any store, whether it's Macy's, whether it's, you know, I can't mention names of anything, but you know, any place that you walk into, some big establishment, how do they know they're in the right place or a place that they're going to feel safe?
I think in our practice and in the hospitals, the biggest thing is cleaning equipment in between patients, even carrying a hand sanitizer on your own behalf, like take it upon yourself to have that in your bag or pocket, just so you have it at your hand at all times. And just knowing most hospitals and doctor's office do have that policy that everything needs to be cleaned and sterilized within patient to patient should give them some kind of security that it should be taken care of for their behalf.
Okay, and let your nose also tell you.
Yeah.
You know, if something smells clean, if something doesn't smell clean.
Yeah.
So Michael, talking about noses, tell us when we walk into a beauty salon and we smell some very interesting things, and I rarely frequent one, as you could see looking at me, but if I pick up somebody that I know someone at a beauty salon, and there are certain smells that are intrinsic or inherent, are they dangerous in any way?
Not so much dangerous, like there was a product called the Brazilian Blowout or the Keratin that when they first came out, this product did have traces of formaldehyde in it, which it was harmful to the client, but it was even more harmful to the stylist, where 6-7 months they took it off the market and they reformulated it to where it's a little more safer. In my salon, we have a great ventilation system, so if anything that they still have that is going to create a bit of an odor, it's been around for so many years, I can't believe they haven't formulated something to make it smell better. But if somebody's getting a perm, it's the perm solution that you would definitely say, what is that smell? To this day, everybody still says it.
But none of this stuff really makes you sick.
Nothing, yeah, nothing so much. And like I said, this now where they reformulated these two products, they also give you, if the girls need to wear a mask, they can wear a mask if they're feeling a little overwhelmed. There's eyeglasses that come with the product, but for the most part, no.
You were telling me before we started the show about some of the ways that you check for allergies.
Yeah.
So tell us a little bit what you guys do.
Well, a lot of times when the client comes in, we have them sit in our chair for a full consultation. If they're getting color, we will look at their hair, we'll look at their scalp to see if they have any rashes, or we ask them their history of allergies. And if somebody does have some sort of a history with an allergy, we give them a preliminary test on their skin, or we even do a strand test to see if they are going to have a breakout and if they can color their hair. They've come a long way nowadays. Even there's plant-based ammonia-free colors that a lot of chemo patients or sensitive scalp clients have, where they're going to be safe and they're not going to have a breakout to the product.
So Lou, tell me a little bit about allergies in your place. I mean, my daughter goes to school in Manhattan at NYU, and I've gone out with her to dinner, you know, when she allows me to. And we talk about all kinds of. You walk into a place, they ask you about nuts, they ask you about anything in the world, and people are allergic to these things, and we've seen people have terrible reactions to them. Is there anything in your restaurant is there any way that you check it out, or are you attuned to what people might describe as allergies? And I'm not just talking about, well, it makes me feel a little queasy. We're talking about some of these major allergies where people, sometimes their tongue swells or they get red.
Of course, people have nowadays, or since forever, gluten allergies, peanut allergies. So we try to recommend stuff, and we carry foods that people that have gluten intolerance can have. We have certain pastas we carry that they can eat, certain liquor, vodka in particular, that they can have that is gluten-free. So we accommodate people that way, and we like to ask the guests if they do have, beginning of the dining experience, we like to ask them if they do have any allergies, just to let us know so we could accommodate them and make sure nothing happens.
Super. And what I'm trying to, I think, accomplish or talk about today is really all the things that people should be thinking about every time they walk out of their house. I mean, we could do a whole nother show about what goes on in your house and safety. We could talk about, having no throw rugs, not having, having safety bars for my patients who need to use, get some support with their hands. But the idea that when you go into restaurants, when you go into a hair salon, when you even go into the doctor's office, what really you should be looking at is just so important. So Dan, I'm going to ask you, even without a question, we were talking about this a little bit before, and any thoughts about this?
So, I mean, when it comes down to it, I feel like, especially if you're sick, you got to take care of yourself, even in the workplace. So if you're, CDC actually recommends if you have any respiratory symptoms or if you have a fever to stay home until 24 hours, your fever is gone after 24 hours or after you finish a medication. It really all comes down to hygiene for everybody. Hand washing is really important. The way you wash your hands too, just putting them under water and just washing like that is not good. Really getting in between the fingers and the front of the hands or the back of the hands, that's really important because we touch everything. Our phones, you're in the bathroom, there's germs all over. So really nipping it in the bud and washing your hands can really prevent further illnesses.
I think it would be shocking if everybody's, I think we see that on television so much, how a surgeon washes their hands. And each finger, each side, and you're looking, you're thinking, especially as a medical student, as a resident, what is this guy doing? This gal, his skin is falling off. The same way I'm sure your chefs wash their hands a lot.
Very important.
Think about communicable diseases. These are really where we're able to see this. And really, as you said, reputation is just so important. So Priya, if somebody is sick, and we'll go back a little bit to more of your background in the emergency room, when should they seek medical attention? So if somebody goes to one of the restaurants, the beauty salon, and they have a cold, Dan was saying wait 24 hours, when should someone actually go to an urgent center or an emergency room?
In a case of a cold, you should wait 24 hours, see if the fever passes. Of course, it depends how you feel. If you feel like you need an x-ray or antibiotics, you should definitely take utilizing the urgent cares because they are definitely equipped to do x-rays. They have well-qualified providers to provide that care to just kind of lessen the occupancy of the emergency room. And of course, if the urgent cares think they can't able to treat you, they will send you to the emergency room yourself. So you don't have to feel like you're missing out on less care or anything like that. With the fevers, less than 100 for 24 to 48 hours, and then also with any kind of nausea or diarrhea, it's also 24 to 48 hours you should seek medical care and then see if that bug or whatever that may be causing the infection passes.
So we're trying to really look to see if that all goes away.
Yeah.
And what's the most common thing? There are a lot of sick people in the emergency room, so you really don't want to go to the emergency room.
Yeah, you're better off kind of taking care of it at home if you can, but of course if you need a little extra help, IV fluids, anything, the emergency room will be able to help you.
Tell me about the recommendations about tetanus shots. I mean, I think about your work. I mean, there are metal items there. In your work, there are metal things, and people can get cut, nicked. Tell us about how often should someone get a tetanus shot, and should everyone get it?
Everyone should get it. I know they definitely recommend it to children. You get like a TD shot when you're younger, and then you get the injection booster every 10 years. So you have to make sure, at least it says actually now 8 to 10 years, because if you get cut or any kind of infection, if you step on a nail, anything like that, that tetanus shot is what protects you. Especially grandparents who are around younger children, pregnant women, everyone should be getting the tetanus. You could be saving yourself.
And that's just so important. I know we mentioned this a few times during the show, but the idea about vaccines are just so important to prevent illness.
Yeah.
There's a new vaccine out now for, not a new one, but there's a reformulated vaccine for 2 different diseases that really was really not effective before. one was something called pneumococcal pneumonia. And maybe Dan, tell us a little bit about the Pneumovax vaccine.
Yeah, so the Pneumovax vaccine, it is suggested for the elderly especially, because, you know, pneumonia can really take its toll, and you know, if they already have comorbidities, you know, it can have a high mortality rate. So it is definitely suggested to get.
Because it's interesting, the immune system of someone 20 is different than someone who's 80. If someone is 20 years old and has pneumonia, they'll walk out with some pills, bottle of pills, and they'll go home. Someone who's 80 years old who has pneumonia, even 90 years old, might not make it out of the hospital. And that's just so difficult. The other is the shingles vaccine. So, Priya, you familiar with that a little bit? So tell us a little bit about the shingles vaccine.
Yes, same. You get it from your primary care doctor. They recommend it, I believe, 60 years and older, just to protect yourself. Because the shingles vaccine is something that you would want to consider, because if you had the chickenpox, it's very painful, and when you're older and you get it, it could cause a lot of lifelong complications for you.
Absolutely.
Yeah.
It's very interesting. I'm 48 years old. I've never had the chicken pox.
Really?
Yeah.
And a lot of people don't know they've had the chicken pox. They
Yeah.
might have
Yeah.
just had a mild flu, upper respiratory tract infection. There's a blood test
Yeah.
that'll tell you this.
Very interesting.
And just say that everybody who works in the hospital has to have what's called a titer or blood work to make sure they haven't had the measles, chicken pox, rubella,
Yeah.
you know, the old German measles,
yeah.
in order to be able to practice in the hospital. And Michael, I have to tell you, I'm just more impressed with the pharmacy that you have in your store.
Yeah.
So I have this mental picture of everybody.
Me too. I pictured it.
For the whole salon, if you're feeling something, we definitely have something in our bathroom for you.
Tell me about eye washing and eye control. Like if you have, I'm sure you have some kind of station to wash out someone's eye if something gets in
Oh,
there.
absolutely. Yeah, we have a kit in the salon that even sometimes as the stylist, a color, a product could fly in our eye. We got to run right to the bathroom, wash it out. But, you know, for the most part, we're all really careful in what we do.
And even in our office, we've got intravenous's, infusion centers. We have all kinds of things set up like
Yeah.
this. And just for one last public health thing, and I don't know whether any of you have it, there's something called an AED, an automated external defibrillator. They have them in the lobbies of hospitals, which I found so interesting that in the hospital, they have something to shock you, to bring you back.
Right.
In the lobby,
Yeah.
when the emergency room is, you know,
Yeah.
a block away or
Yeah.
inside the building. And the idea that many places, and I was in the past the president of the American Heart Association on Staten Island, and through the borough president out here, really tried to get these little baseball fields and things like that. So you talk about public health issues. Even going to a Little League game, if you get a child hit in the chest, they can get an arrhythmia.
Yeah.
Someone at the restaurant, I mean, I'm sure you teach at least some amount of the Heimlich maneuver in order to try to prevent someone from choking. And these AEDs, we have one in the office, is really a miraculous thing. The idea that someone could be shocked back to life, you know, in that situation. Calling EMS sometimes just takes too long.
I don't think in my salon, I don't think we're required to have it, but somebody years ago, somebody did actually. She was on her way to passing out. Passing away, and thank God there was a nurse there that did.
I'm
take
going to
care
say
of
goodnight
her.
to us because our half hour has gone by. I want to thank everyone and be safe when visiting your small businesses. Thanks, guys.
Fun.